Warinner. I am a breast cancer survivor. I was diagnosed in July of 2006. What I'd like to talk to you about is what I have learned about breast cancer and how important it is that we get this diagnosed early. I am also a patient advocate at St. Joseph Breast Center. I work with patients along with our nurse navigators, Mary and Janie, to educate women and men about their diagnosis and help to make their plan. I'm also a Reach to Recovery volunteer at the American Cancer Society, and I've also written my own Proactive Breast Care 101 educational packet. I do talk throughout the city educating women because what I see mostly is that women are educated the day of diagnosis. Sometimes that can be a little bit late. What I'd like to do is take these women back 10, 15, 20 years, educate them at that point, let them know what they need to be looking for, tell them the myths, the risk factors, show them how to do a proper breast exam, educate them ahead of time so that when they are diagnosed, and many of them will be, that it will be caught in the very earliest stages, which is the best time with any illness to catch it in its early stage, for your options to be more than just one. You may have multiple options now, and you will also have a better survival for treatment, and maybe we can eliminate these late stage breast cancers by educating women early. One of the important things I do want to stress is self-breast exam. As Dr. Geyer said, most women will not start baselines until age 40. If they have a family history, they can get insurance to probably give them a baseline at 35, maybe 30. But what you can do, and nobody can dictate this to you, is do self-breast exams. Majority of breast cancers, a good portion of them, are found by women. I found mine. I had an MRI, a mammogram digitally, which is very important, and an ultrasound 6 months prior to my finding a lump and then having it aspirated, and then a lumpectomy where they found cancer on the margins, and then I went in and opted for a bilateral mastectomies, which is the left breast had cancer, the right one was not cancer at the time, but it was high risk to develop cancer, and so I chose to do that. Checking your breasts is very easy. If you're a young woman and you're menstruating still, you want to do that between the 7th, 9th day of your cycle. So if you start on the 1st of the month, between the 7th and the 9th, start examining your breasts. That's when everything is very calm, because once you start getting into the cycle of ovulation or prior to menstruating, your breasts are going to be tender and gorged. Not a good time to be examining them. Also, that is also a good time to schedule your mammograms. If you're a male or you're a woman who's post-menopausal, then do it the same time every month. I can't stress enough that nobody can dictate what age you can do a breast exam. And when you do, make sure that your doctor doesn't tell you, well, you're a guy. Guys don't get breast cancer. Well, we now know they do, and they always have, but we have a lot of doctors out there who are not educated in breast care, and yet they're treating the women. And then we also have doctors still telling women you're too young to get breast cancer. I have seen women as young as 22 with breast cancer. So do not let somebody tell you you're too young. Don't let anybody tell you we're just going to watch it, because there's so many biopsies. To biopsy an abnormality, a lump, or a thickening in a woman's breast was through a surgical biopsy. Well, that would entail general anesthesia, which has its risk factors. Now, there are so many biopsies available that can be done in the doctor's office or in an outpatient hospital setting, and these can be done with the local anesthesia, so the woman is completely awake, or the man, and the biopsy is done. So because we have those options now, that pretty much there's very little risk of any issue happening to the patient with those, there is really truly no reason to watch it. Because if you watch something, the more you watch it, and if it starts to change, by the time you do decide to do something with it and biopsy it, that could change your options on what to do if it is malignant. It could also change your survival rate. So do not let any doctor tell you, let's just keep an eye on it. Have it biopsied, and if it comes back benign, great. But if it doesn't, you are that much more ahead of the game, and you've caught it early, and that gives you the options surgically, and it also will assure a longer survival rate by catching it early, because anything that's detected early is going to give you the best shot at a nice, long, healthy, happy life, and that's what we all want. I have put my educational packet up on this website, so you can go to the link, and it will tell you the myths, the risk factors. It'll explain everything in terms that you can all understand, because I'm not a medical person. I had to learn to understand it myself. So it's very, very easy reading. It will also tell you if you have certain kinds of breasts. That's another thing. We need to know what kind of breasts we have. We're all different. And if you look at this, you will be so much more educated that you possibly will even be able to educate your doctor when he starts to throw out these little things that we know or miss. So the best gift that you can give yourself is to be educated. It's also the best gift that you can give your son, your daughter, your sister, your brother, your husband. Get yourself educated. And in educating yourself, you most likely will be educating some of your doctors too.